Hey everybody, you are about to watch the Dr. Jaime Show. I hope you enjoy this episode. Good morning and welcome to the Dr. Jaime Show. Happy Friday. You're going to have to work with my voice today. I am sorry, but the Dr. Jaime Show is all about increasing likability, success, and happiness. And today we have an awesome show ahead of us. We have Dr. Colleen Maxcy, who is a pain doctor, on site with us today to chat with us all about pain. And I thought this was such a pertinent episode because so many people live with chronic back pain. And unfortunately, there is now an epidemic of so many people being addicted to these pain pills. She is going to talk to us about non-invasive surgeries that can get you off of those pills and living a much different life. Don't believe it? That's okay. I didn't believe it either. So you know who we have here? We have reps on site to talk about the product, why it works, and we have a patient of Dr. Maxcy's here to show us his scars, show us how he's hooked up and what is going on, and tell us that he has been off of the pills now after 20 years of being on them for his back pain. So we have a jam-packed session. Just hold tight. I want to give you a little recap of the week and a rundown of who to expect. So next week is the 23rd. We have President of Marketing Matters on the show, Colleen Stearns-Leith. So you want to gain more social media followers? That is going to be the episode for you. On the 2nd, we have Dr. Michelle Fisher coming on the show. She is an ears, nose, and throat doctor, an ENT. And she is going to talk to us about allergies. Wow, it is the season, right? I saw something on the pollen yesterday, and all 3 of them were high at the max that they could be. So I'm sure several of you struggle with allergies. So if you're not in back pain, then you probably have allergies. So I have a segment for both of you. And on the 9th, we have Sarah Dilring on the show. She is a professional organizer, and it is around the spring cleaning time, so she is going to give us little tips and tricks, more than just your house and your Tupperware and your closet. She's going to even chat with us a little bit about how to organize that garage. That's right, you don't want to see our garage. No, you don't want to see our garage. And then, guess what? It's spring break, and I'm going on spring break too, so the show will take a week off. I know you will miss me. We will have the audio shows, and then we resume on the 23rd with Akash Patel. He's going to tell us how running in his specific campaign is going and update us. He has been on the show 2 other times, so he will be our most frequent guest we've had on the show. And then on the 20th, we have a segment on bullying. So we are rallying a team of people together, and they're in their 20s, and they go around talking to schools about bullying, ways to stop it, ways to notice it, and ways to handle it. So we will have a few guests on the show later in March. And believe it or not, that's going to bring us to April. So I will keep you posted on the guests for April. So a little bit about the week. My voice was perfectly fine on Wednesday. 6:15 at night, my voice was perfectly fine. We dropped the boys off at church. We walked into the church. We dropped them off. Took maybe 2 minutes to drop them off. We walked out and my voice was like this. Walked in fine, walked out like this. I don't know what happened. Don't ask me. We have a doctor here. She says she can't help me. So she says, if it was my back, she could do something. My voice, no. So you're stuck with this today. I don't know what happened. I'm just so thankful it is not the flu. So knock on wood. Thank you, God. What else do I need? Okay, so the big thing, the shootings. We need to talk about what happened in Parkland, Florida. What an absolute tragedy. If you haven't taken a moment to pray for the victims and for the families, I say we take about 5 seconds now to just think about that. While we are preparing for our weekend, while I am sitting up here running a show, there is a mother or a father that is planning their 14-year-old's funeral right now. They are purchasing the clothes that she is going to wear. We are going about our day. I understand life has to move on, but we have got to find a way. I wish I knew the answer. I don't know the way. I know that as a woman of one, I can try to increase success and happiness and likability. And with my show, I hope that I bring happiness or motivation to maybe one person out there, and that one person is nice and then decides not to have road rage today and cut off a person. And the person that they didn't cut off then opens the door for somebody, and that person that the door was open for buys someone's Starbucks behind them and just passes on the kindness. Please remember that when you are in a rush, and you do something negative to someone because you're just so in a rush, that person remembers that negative thing and they pass on that hate. So when you cut me off, let's say, I'll just use me as an example. If you cut me off in road rage, now I'm mad. So I cut someone else off, who then yells at their daughter when they go home, who then doesn't open the door for someone, yada, 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 on and on. Remember that kindness will continue to brew kindness, and hate will continue to brew hate. So please find ways every day to just bite your tongue and take a step back and not be so mad at someone, because this hate is getting out of control. I pray for what happened the other day. I hope that you are praying, and all we can do is just educate and continue to pass kindness and happiness. If you want to make mean people mad, be nice. So that is my Dr. Jaime tip for you of the week. One last thing, if you want to go ahead and check out an article or an interview I was recently in, you can learn a little bit about my past. It's something I haven't opened up about. What I wish I knew then that I know now, and a little bit about what I do. You can go to Thrive Global, type in Dr. Jaime Kulaga, Thrive Global, and you can find out a little bit about me and how my journey got started. So it was a great interview. I hope that you enjoy it. Now, the moment that you've been waiting for, what you really came here to hear about today, is a little bit about how to get out of pain. Dr. Colleen Maxcy, pain doctor, come on out. Give me a hug. She's not prescribing pain pills, but she will do a surgery on you. Welcome to the show.
Thank you.
Yeah,
Thanks for having me.
Absolutely. So you were on before.
Yes.
Yeah, so she was on before in a Woman's Power Hour segment we had. That was fun.
It was.
That was a good segment. So before we begin, just like every other show, I have to know something unique, bizarre, interesting about you that no one or few people know. And since you're returning, it can't be what it was last time.
Okay. Well, I think professionally, I am a doctor on a mission.
Okay.
If a patient has pain and we try a procedure and they still have pain, I don't want to stop. I want to just go until we can completely eliminate that person's pain.
I love it. Excellent. So you're not giving up on them.
No.
No. Excellent. Yeah, and we are going to learn a lot about that today. So I guess tell us your journey on how your life led you into being a doctor.
It was a long journey.
Uh-huh.
I initially started off in research and laboratories, and then really found my calling in medicine. I love medicine and I love helping people.
Okay. So were you like 3 years old and you were playing doctor in your room and said, this is what I'm going to be? Or did it come at a certain middle school, high school? What?
Really in college.
Okay.
Yeah.
Okay.
And I found I really like being around people and helping people.
Okay.
And patients in pain can be very challenging to help.
Okay. And so you kind of wanted to woman up to that challenge in helping people through pain, right?
Right.
So what year? I'm trying to think about making my way to a point here. What year did you realize you wanted to be a pain doctor?
It was when I was in my residency. So I had already completed medical school, but I found the patients in pain clinic were the most challenging to help. And so I kind of fell into the role, and I really enjoy what I'm doing. I'm living my dream.
I know, I am too. Isn't that a great feeling?
Yeah.
I love that. Yeah, I wanted to know because I feel like pain pills are like, I don't want to say like the new thing because they've been around for a while, but like dealing with pain, and I don't know, I just feel like it wasn't in 1982 when when I was born, I just didn't feel like that was a time of like everyone's hooked on pain pills. I don't know if it's changed or what, but I feel like it's such an epidemic now that people don't smoke cigarettes, they're taking pain pills. Like it's just becoming such a problem. So have you found that? Is it increasing? Is it decreasing? Do you know?
Well, I moved to Florida in 2010, and I feel like that was right around the height of the pain crisis.
Yes.
And so there were lots of pill mills. The state was cracking down on the pill mills. And as a physician in a pain clinic, it was challenging to try to help patients and provide other options besides medication.
Okay. We're going to talk about that too in a second. So USA Spine. Okay, you are the owner of it.
Yes.
Okay, how did you get to? So you're in residency school. Now you own this. What happened in the middle? How did you decide I want to do this and own my own company?
I worked for several practices as an employee, and over time I kind of figured out, my specialty is interventional procedures. And so my goal when I see a patient is really how can I change and stop their pain rather than manage their pain.
Okay.
And so I consider myself a pain medicine doctor, not a pain management doctor.
She's a pain stopper. Hi, I'm Colleen. I'm a pain stopper.
That's the goal.
That's such a great point. Yes, it is. It's all about pain managing. Right? I mean, if you think about it, that is exactly what it is. But you're stopping it.
I'm trying.
I love it. Okay. So pain management specialist. What is that?
Well, there are many ways to stop pain or try to eliminate pain. One is through medications, another is through procedures. And then other modalities like chiropractic treatment, physical therapy. I think sometimes it takes lots of different things to really help a patient reach a level where they're no longer in pain.
Okay. Have you ever had a patient that was very, very tough to figure out exactly what they needed? Are they all that way, or is it very tough across the board?
I welcome the challenge.
Yep.
And a lot of times, I might see a patient and their MRI will show a massive disc herniation. And on exam, they have findings that suggest, yes, the herniation is the cause of pain. But then if we do a procedure and they're still in pain, then that's the challenge of where is the next pain generator. There's different parts in the spine that cause pain.
Okay.
And so, that's kind of the world I live in, trying to figure out, where is the pain and how to get rid of it.
That's so interesting. So you can see something, you have a spine, and we're gonna talk about that later. But so you could see like, okay, the pain is coming from here. You fix that, but then the pain could also be coming from somewhere else as well.
Absolutely.
Amazing.
Yeah.
That is a puzzle. I love it. Okay. All right. So pain management specialist. All right. So now, and I want to read this question verbatim here because I think that a lot of people have this question. Okay. There was a time I remember here in Florida that people could walk into these pain med clinics, pill mills, say that they are in pain and get prescriptions for pain pills at the drop of a dime. It didn't seem regulated, but times have sure changed. What are the challenges you have faced and currently face practicing pain in Florida, pain medicine in Florida?
I don't see it as challenges, I see it as improvement.
Okay.
So the state has really helped to regulate the practice of pain in Florida, and it really it makes my job easier.
Okay.
So again, I came in right at the height of all this in 2010, and the state, I guess it was certain cities and counties actually put moratoriums in place, so no one could open a new pain clinic. And they were really cracking down on the clinics that were writing high dose medications and maybe not for the right reasons.
Yeah.
The state created a database called eForce, and of course you have to register. No one can just type in eForce and find information, but eForce was...
We've got all the viewers logging onto eForce right now. eForce.com, am I in this?
But it's a fantastic tool that really helps. If I have a patient come into my clinic, I can type in their name and their date of birth, and it will tell me the prescribing history. Mm-hmm. So the different type of medication the patient was prescribed, when the patient filled that medication, the prescriber who wrote the medicine, the dose, the quantity, and then the pharmacy where it was filled. And so that tool has really helped us to stop doctor shopping, to stop the over-prescribing, because we can now see, if I have a patient come in my office, did they fill a script 2 days ago with another doctor, yesterday with another doctor? We now know that. So it really helps us to manage our patients much better.
That's excellent. And even if it drives a patient crazy, you are saving lives by this e-force. I believe that. Off the cuff here, just a question that came to mind. So you probably have people that come to you that have been in pain for years, so they've been on medications, because some of these new surgeries are relatively new. They weren't here in the 70s, right? So do you coming off pain pills, I'm sure you've got a couple people like, oh my God, I can't even imagine coming off of them now.
Yeah.
What do you wean off of them? Do they have to go in for these? And we're going to talk about like the methadones and stuff. How do you deal with it as a doctor when you've got someone on these high doses of pills? How do you deal with it?
Well, I don't really see it now like I used to.
Okay.
5 years ago, that was more of an issue.
Okay.
And again, it's because of the state regulations. We don't have patients on these really high doses like we did.
Okay.
But the goal is to eliminate pain. And so if someone has been on a medication for a long time, my thought is not, oh, let me continue the medicine. It's what else can I do to stop the pain, and then they can wean off the medication.
Okay, excellent. Okay, what are opiates?
Pain pills,
Okay.
derived from opium, but it's a product that basically helps to eliminate or relieve pain, and also causes a little bit of sleepiness.
Okay, what are, off the cuff, what are some common ones that people might know?
Percocet, Vicodin. There are synthetic opiates as well as more natural derived medications, but these are technically controlled substances, and so the DEA has created just a structure of categories of medications, and so an opiate would fall into a specific category.
Okay, so I've heard of people, believe it or not, being prescribed like the morphines and the Dilaudins, I think. Are those under opiates?
Yes,
They are.
They're under controlled substances, yes.
Okay,
Yeah.
some of those are extremely heavy medications that these people are on, and they're operating life. They're taking these morphines and then they're driving cars to get to work. There is a serious danger in that.
Well, I have kind of my big four.
Okay.
So when I do write a medication, which isn't often, but when I do write a controlled substance, patients sign a document and then we discuss, and I feel very strongly, do not drive, do not drink alcohol, do not care for children, and do not sign legal documents when you are on these medications.
Yeah, that's such a, even, obviously driving the car and stuff, but, legal documents. Think about it, if you've been on these pain pills, living life for 5-10 years that way, and you're in this increased dose, and now you're signing some serious papers, no way.
You're good.
No good. That is not. I did give Wes a pill before we got married. Take this, honey, and sign this document.
I'll take both.
Okay, so I hear all this stuff about people being addicted to pain pills. Is this an epidemic? We kind of touched on that, but do you think it still is?
I guess that's really, depends on your audience and who you're talking to. In my opinion, it was more of an issue, again, like 5-10 years ago, but now we're in a different era.
Okay.
Yeah.
Okay, good, which is a good thing.
Yeah.
Okay.
Yeah.
Myth or fact? If you want to get off pain pills, you should consider methadone.
Methadone is an option,
Okay.
and I'll stress option.
Okay.
There are a lot of different ways to come off of pain pills, but methadone is definitely an option.
Okay.
It's an opiate, and
That was my next question. What is methadone?
So it's an opiate, and then it's also used in drug detoxification programs.
Okay.
So if someone maybe has been addicted to heroin, they could switch to methadone. And methadone won't give the patient that high, but it's in a class where it targets kind of those same pain responses that the patient may have had.
Okay, so do you have to be under care or watch when you're taking methadone?
Yes.
Okay.
Yes. And so there are clinics that will monitor patients on methadone. I have not written that medication in many years.
Okay.
Because that's not what I do.
So not giving anybody medical advice here, but just sort of so I can understand. Is it better if you want to come off pain pills? So let's say I'm your patient and I'm like, I want to get off these pain pills, Dr. Maxcy, what can I do? Do you think it's better for me to take the methadone route, or do I wean my dosage on the pain pills? Is there like one that's safer or better?
It depends on the patient. It depends on the situation. If someone's on a really high dose of a medication, they could stop it cold turkey or they could wean it off. I think everyone, isn't in just a clump of like, this is how we do it. It depends on the patient.
Okay.
And then it depends on their goals. Some people, or when they're done with pain medicine, then we might not even talk about the weaning process. We're talking about what procedures can we do to eliminate the pain.
Okay. Yeah, because it can be dangerous too if you are on a high dose to just stop, right? Don't you hear of people like getting like the shivers or like weird things coming off pain pills?
You do,
Yeah.
but then, life continues.
Yeah.
Usually in that first 72 hours, that's the worst time frame.
Okay. And I know, separate, everyone, those of you on antidepressant medicines out there, this is a Dr. Jaime mental health warning. You cannot quit those cold turkey. You have to wean off an antidepressant. So just a word to the wise there. Don't think every drug is different. So coming off or going on to something, always ask a doctor, your doctor, what the right way is to manage that and come off of those. Okay, here we go. Myth or fact again. Pain pills have increased America's heroin addiction or crisis.
That's a great question.
Thank you. Thank you.
I have a statistic on that.
Yeah. I want to hear it.
Okay, so in 2012, in the United States, it was estimated that 2.1 million people were suffering from substance use disorders related to prescription narcotics.
How many was that?
2.1
Okay.
million. At the same time, there was an estimate of 467,000 patients were addicted to heroin. So, but then over time, and I've seen it in the world of pain, if a medication is taken off the market,
right,
and a patient has been on that medicine for many years,
that's what I'm thinking.
The patient will try to find something
to supplement.
Yeah, and so if heroin is there, are some of these patients transitioning? Yeah.
And now they are cracking down. You said, what is it called? The
E-Force.
E-Force, right? They are cracking down so people aren't getting what they need. They are addicted to this stuff. Even if they didn't want to be addicted in the beginning, now they are, and they could be. So what would you say to that answer?
Come and see me.
Come and see me. I love it. That's why I have her on the show. Okay, I want to ask a question about a child here. If a child is in a car wreck and has neck pain or back pain and is prescribed pills, I am sure this could lead to a very bad path for the potential of addiction, right? A 12-year-old now starting Percocet, okay? Any tips for parents about anything in this realm? So if there are parents out there that have kids that are on pain pills prescribed by a doctor, now what?
Well, and that question or that concern is definitely something that I see and I try to work with, but there is a fear of addiction, but sometimes that medicine is necessary for a short time.
Okay.
And my philosophy is, what else can we do? If the patient or the child has bad pain in their neck or their back, physical therapy, chiropractic treatment, ice, rest, anti-inflammatories, just as long as those other modalities are brought into the picture, that's when I really feel like you're doing all you can.
Okay.
Naturally, if it's an injury, the patient should feel better in time.
Okay.
And so I don't see as many people that have that fear of addiction. It's hey, the last 2 or 3 days have been bad, and now I'm able to do X, Y, and Z.
Okay. So you said they should be. Sometimes people need to be on medication for a short period of time. I absolutely agree with it. If I got in a car wreck, knock on wood, I would probably need something. What is a short time? Is a short time like okay, they've been in pain for a year, now they should come to you? Or whoa, a year's way too long, it needs to be 2 weeks. Or a year's not long enough for a car wreck. 3 years in pain, come to me. What?
It depends on the nature of the injury or the disease course.
Okay.
And so the definition of acute and chronic pain varies depending on your source that you're reading. But if a patient breaks or fractures a bone, maybe they do need a couple days of a narcotic. But the goal would be that this is not something long term. And I think that's where we're moving in the state, is to avoid even maybe offering a long-term solution without trying some of these other modalities.
Okay. All right. Excellent. Okay. How is your practice different than a typical pain practice? So we've got these pill mills, or we have these types of places. What is so different about what you do?
I really don't write pain medicines.
Okay.
So I am a pain doctor that does not write very many pain medicines.
Wes, you're out of luck. Just playing.
And so my goal is interventional spine procedures. And we treat all types of pain, but if someone comes into my office and they have lower back pain, I'm not thinking, what medicine do I write? I'm thinking, what procedure can I perform to hopefully eliminate their pain.
Okay, excellent.
Yeah.
Very good. Okay, and we're going to talk about those procedures, and we are going to show you. That's why we're kind of speeding through this relatively quickly today, because we're going to do demonstrations and show you a lot today. There are many people that want to be out of pain without getting on pain pills. What are some of the procedures you perform to alleviate pain, and how long, if at all, do people have to be on pain pills after the procedures?
Well, I would prefer for a patient to not start pain pills.
Okay.
And so I have a lot of patients, they're taking anti-inflammatory medication. And many of the anti-inflammatories, we actually have them hold that medication before the procedure and then for a time frame after.
Okay.
But in my practice, specifically speaking in the spine, I do epidural injections, I target the facet joints.
Okay, so let's take this one by one. Epidural injections. What are they for? And I remember having an epidural when I was pregnant. And I have to stop and tell the story. They asked me if they could have the intern do it. Nothing against interns, nothing. I was in my 20s, and it was at a time in my life when I didn't speak up, but you better believe your ass, I spoke up that day. And I said, nope, I want like the Mayo Clinic doctor to come in and give me the epidural. And I had to hunch over, so the intern did not do it, for those of you out there. And I had to hunch over, and they did it. It actually ended up working out. The guy did the epidural as soon as a contraction came on, and the contraction was so painful that I did not feel the epidural. Thank you, God. And so God was with me that day. Anyway, so every time I hear the word epidural, I'm like, okay, I need to know. So what are they for?
Well, a little different in my practice. So
Okay.
if someone has a disc herniation or they have pain in the spine, I inject steroid and numbing medicine into the spine to just block that inflammatory response.
Okay.
And pretty much the majority of procedures, I use a C-arm, which I can see the spine through X-ray. So when you had your epidural, there's baby there, so you can't just lay on an X-ray table and make sure we're in the right spot.
Right.
But a lot of so my procedures are very controlled because I'm using that X-ray machine.
Okay, good. And I wanna get into this because I know people need this, but they're scared. So okay, pain on a 1 to 10 getting these epidural injections. Be honest with us. Where would it be? Is it a 10? Is it a 12?
Well, I've had 2 epidurals with my babies,
Yeah.
and I didn't think they were that bad.
Okay.
But everybody feels pain differently.
Okay.
And what I can tell you is that from what we have seen, the worst part is that pinch when we numb the skin.
Okay. Okay, good.
Yeah.
Excellent. And you're watching it on this X-ray, so I've heard of people like, oh, the epidural, oh, that's not the right place to put it. And they try like 4 times. Actually, I think that might have happened to Jenna West, where they tried different spots. Do you know where to go?
Well, again, we've got the X-ray, so we see where we're going.
Okay, good, excellent. Okay, and now why would somebody need this specific? What could someone be feeling right now that this would be good for them?
Pain.
Okay. Pain. Okay. So
Yeah,
just
we wouldn't.
generally.
Yeah, I wouldn't want to do a procedure if the patient didn't have pain.
Right. Okay, but it's not like specifically for lower back or. So if someone comes to pain.
Low back, that sciatic pain down the leg.
Okay. Okay, that's what I'm talking about.
Yeah.
That's a huge one. The
Yeah.
sciatica for people.
Yeah. Epidural is a great solution for that
Okay.
type of pain.
And how frequently? I know it probably depends on the patient, but what's the general for something like that?
I don't like to perform more than 3 in a year.
Okay.
And if we've reached that second or third epidural and the patient still, they may have a period where they feel great and the pain comes back, I'm starting to think, what else can we do? Because this isn't really holding. You
Okay.
know, I want to try to do the most minimally invasive procedure that
Lasts.
eliminates the pain that lasts. you
Okay.
know.
Okay.
So there's other things we do as well.
Okay.
We can talk about.
Yeah, yeah. And then real quick, one more thing on that. After someone gets an epidural, are they down for the day? Can they go to work, do this on lunch and go to work? How does...
Patient specific. So
Okay.
I have had patients without sedation, and they go to work like right after.
Okay.
But you know, if they're a heavy laborer, I would not recommend it. If they're sitting at a desk, then you know, if they can't miss work, then that is a possibility.
Okay.
But then you know, the majority of patients they tend to take that day off
Okay.
and go to work, you know, the next day.
Okay. So we've got the epidural that you offer. What else do you offer?
Well, we're going to talk about spinal cord stimulation.
Yep.
And we have a model here.
Can you show me?
Yes.
Okay.
So this is these little wires
Can you
here.
want me to show? Let me
Yep,
see if I can get
okay.
close and show.
Okay.
All right. So. All right. Each of the. You want me to show it on this one?
Yep.
Okay. Can you see those right there? I wanted to show the different platforms. That's good. All right. You see these right here? All right, for y'all. All right. And then one more over here if you can see those right there. Okay.
So this device delivers low-level electrical signals to the spinal cord and blocks pain.
Okay.
Okay, so it's inserted exactly like an epidural, but instead of medication, we put these tiny wires in the spine.
Okay. Why would someone come to you for this? And have they tried pain pills? Have they tried the epidural? And this is a last resort kind of thing? Or when? How?
Yes, and even someone who may have had spinal surgery and they have pain after the surgery, this is an option.
Okay, excellent. Okay, so the people that have already had back surgery, they're not out of luck.
No, come
Okay.
come and see us.
Okay, okay, excellent. So, okay, so show us again. Okay, so if you insert it, you're inserting it where? From the bottom up?
We generally go a little bit higher. The model's not completely accurate.
Okay.
But the goal is for these little wires just to sit right outside the spinal cord.
Oh, wow, excellent. So now if someone has pain, let's say they have pain that's here, okay? Do you have to put it in here? Do you start it where the pain's at?
It's like a waterfall effect. So you want these electrodes higher than the pain.
Okay.
And then what's really neat is there are multiple programs. And so if a patient has pain down the left leg,
Mhm.
well, that might be program number 1. If a patient has low back pain and right foot pain, program number 2. So it really tailors to the pain, but you know, on a daily basis, if the pain is moving, the programs on this device can capture it.
Wow, excellent. And now we will have, is this the patient that you have here? Did he have this done?
Yes.
Excellent. So we are going to hear about that in a moment. Okay, is there anything else about which one is this? This is the spinal cord stimulation. Okay, so we're going to have him out in a moment to talk about his story, show us a little bit, because there's a little battery pack with it that he can show us, right? What are some other things that you offer? I have, the Spinal Simplicity, the Stim Wave. Tell us about
Right.
those a little bit.
So Spinal Simplicity, we don't have the model here,
Okay.
but it's basically a very tiny device that is inserted like so.
Okay.
Okay, so I'll just pretend that
Yep.
right in here. So if you have narrowing or tightness in the spine, okay, and you put this device in, it lifts and opens that area up.
Nice.
So if there's compression, it can just basically relieve that area.
Okay, so
Okay.
what's happening there? Is there a lot of bone-on-bone pain, and that's what they're feeling?
It can be, right?
Okay.
Yeah.
Okay.
Yeah, and then compression on the nerves. So, you know, if there's nerve or spinal cord compression, this device just inserts from the side and helps to kind of open that space.
Excellent. Are any of these, I'm sure some people want to know, are all of these out-of-pocket costs, or is this something that health insurance would consider helping to cover?
health insurance covers the majority of these procedures.
Nice. Yay. That's great for so many people. Okay. All right. Very good. So, Stim Wave.
Yes.
Okay, so we do have someone here that's going to talk to us about it, but can
Okay.
you explain to us a little bit about it as well? What do you do? Why would someone come to you for Stim Wave?
Well, Stim Wave specifically is it's a device that we just implant kind of these pasta wires.
Okay.
And there's an external battery source, but this is neuromodulation, spinal cord stimulation. We are just changing the pain signals in the spine. So here's the battery, okay? This is external. There are different companies with different products on the market, but Stim Wave specifically has an external battery. Other companies offer a battery that's implanted, and it's really patient specific. You know, some patients, oh no, I don't want to deal with the battery, I'll just have it implanted.
Okay.
And then I guess we'll let
Yeah.
them talk further about it. But yeah, it's a great product for pain. And lots of different causes of pain, but what's nice is there's a trial period, and so the patient, we actually insert these wires, and the wires kind of stick out of the body, we tape them up, and the patient can try the product for 3-4 days to see if they like it.
Wow, this is like when they let you like take home a couch for 2 days and you see, is it really as comfortable as it looked in the store?
Like test driving a car.
Right, exactly.
And if the patient likes it, then we'll move to the permanent implantation. And I was talking with some of the people in my office, and I said, can you think of a patient, and over the course of time that we can't think of anyone who has trialed who has not wanted and moved forward with permanent.
Wow.
So that's great success.
That's great success.
Yeah.
What is the difference between what Dave has that he's going to talk about in Stim Wave?
He has Stim Wave.
Okay, he has Stim Wave.
He does.
What's the other one? The Spinal Simplicity, right?
The Minuteman, right?
Okay.
Right.
What?
Spinal
Okay. So
Simplicity.
what is the So the Spinal Simplicity is going in between, almost like the discs, right?
It's going between these posterior
To open it
bones.
up.
So if this was my spine,
Yep.
okay.
Yep. Yep.
We're putting a spacer in
Okay.
the back part of the spine.
Okay.
And it's good for certain patients. There are patients that may need more hardware and
Okay.
more stabilization, but it's a stabilization device
Okay.
that just kind of fits in the back of the spine.
Okay.
Okay.
And people that might already have had back surgery that have they put things, sometimes they put things in your back, right? After when you've had the surgery, do you take those things out when they come in and get a new surgery, or do those pieces they already have in their back stay there and then you add to it?
I'd say that's patient specific, but what's nice about the stimulator is if there is surgery and there's hardware in place, we place this device and it's in a different area.
Okay,
Okay,
excellent. Okay,
yeah.
good. So I know just so many people that have had back surgery, and I'm sure they're wondering, can I do this? Can I do this? And if you have any questions, please type them in the chat. We will do our best to get to them. We have Wes reading off the questions right now, and then if someone asks a question, maybe later on, you could write in the forum or the chat and answer their question. Okay, so we have Laura Perryman here, right?
Mm-hmm.
She is the owner of Stim Wave. All right, Laura, you want to come on out? Excellent. Give me a hug. Thanks so much for joining us today.
Thanks for having me.
Yeah, take a seat. All right, so the owner of Stim Wave, am I right?
Yes.
Okay, excellent. So where did you get this idea from? How did this happen? And tell us about it.
Great. Well, actually, I retired,
Okay?
and I went back to get my PhD, because
Okay.
that's what retired people do.
Yes?
And I was studying neuromodulation for diabetes.
Okay.
And so I needed a device for my little rats.
Mm-hmm.
And my background was engineering, so I had a background in wireless devices, a background in semiconductors, and in communication protocols and software.
Okay.
And so there was no device on the market that can fit inside of a rat. These devices have these massive batteries.
Yeah, can you imagine this little rat with...
Yeah, it was bigger than the rat. So we needed a wireless device that we could put inside the rat, and we could transmit the energy to him from the top of his cage. So a colleague of mine was working on small devices powered with ultrasound, and we changed that to be powered with microwave. And that's how it came about. And we showed it to a lot of people, and we wrote papers about it. And people said, well, why can't you use this for pain? So we didn't know anything about pain management. We didn't know any pain management doctors. And we said, well, because we don't know anything about pain. We know about diabetes. And we said, well, it's the same thing, and there's a lot of people that want to get stimulators and not have drugs, but they don't want to have a battery. The batteries have lithium ion in them, just like your cell phone. And you know that those can blow up on certain airplanes.
Yeah.
Things
Yeah, that's
like
not
this.
good. You don't want to blow up.
Right.
You don't want to combust after back surgery.
Yeah. They can leak. They have a lot of complexity to them. 85% of the problems with spinal cord stimulation are due to the batteries.
Well, and we talked about the MRI too, right?
Right.
You would, and something I would have not even thought about was if you have certain types of batteries put in, or right?
Not all batteries, but there are certain batteries that are MRI compatible,
Okay.
but then there are batteries that are not.
Yeah, and you've had this done, and now you can't get an MRI for the rest of your life. Like, that's crazy.
That's correct. And we're the only product that you can get a 3T MRI,
Okay.
which is the more high intensity one to see more structures.
Nice.
So if you ever get cancer, they're going to want to give you a 3T MRI, right? Versus the lower quality one. So with our product, it's so small, it basically goes in through a needle. Most patients are willing to try this device versus the concept that they're going to have a battery implanted in their spine forever. The other thing with batteries is you have to recharge them. So you still have a maintenance to it. With ours, you just wear it in your clothing. So you do wear something external, but it's very small, very light, and it's just like you put on your clothing every day.
Yeah.
You include this in your clothing. So it's convenient to your lifestyle.
Wow. This is amazing. How many patients have you had that have used this?
Oh, I can't think of the number.
About a dozen.
At least.
Amazing.
Yeah.
And they're happy.
Yeah,
Yeah.
and we are pretty new, a year and a half. This
Okay.
product's been on the
Wow.
market. And we've had over 2,000 patients.
Amazing. Amazing. You owe all of your life to a rat now. Thank you, little rat, for being so small. Awesome. Well, thank you for sharing. Is there anything else that we need to know about this product before we bring on?
Yeah,
I got
absolutely.
a question. How long does it take it to get to market after you did the trials with animals? Like, how long does it take for FDA to approve it to actually get it in the market?
We have 2 generations. The first generation was about 3 years, and then our second generation, which are these latest products, took about another 2 years.
Okay.
So, but we have all the features of the products with the batteries in this generation.
Cool.
So it was a relatively quick process, very expensive process.
And then do you want to talk about PNS?
That's what I was going to
Yeah.
say. The one other thing I'd like to tell you about is we're the only company that has approval by the FDA to put them both in the spine, but also anywhere else in the body. So if you've had knee surgery, or
That's huge for people, the knee. Yeah.
shoulder surgery, we also treat pancreatitis, pancreatic cancer pain, pudendal pain, pelvic pain. There's a huge unmet need. So we're the only device that's FDA cleared for those indications.
Amazing. How awesome. That is great.
Mhm.
Yeah, in fact, I'm thinking of some clients of mine that could really benefit from this. So how long does it take to do the surgery?
The trial is about 15 minutes.
Okay.
Yeah.
All right, let's do it live. Let's go ahead. Amazing.
Yeah.
Awesome. Okay, anything else we need to know? That's it? He'll tell it all, right?
Absolutely.
Okay, thank you so much for joining us. Okay, so let's see where we are at. I want to get to a couple more questions, I think, and then we're going to bring out Dave Perrego to talk to us about Stim Wave and the surgery that he had. Okay, so, and I was going to ask you this question. So you're helping people with pain in their backs, but who should people turn to, if not you, for leg, knee, and joint pain? Do you do anything with that?
We treat any type of pain.
Okay.
Yep.
Great.
Yep.
Just can't help this voice today. You can do anything else. Okay, so I say that we bring out Dave and we talk with him. Dave Perrego, come on down and tell us a little. Woo, I need like some music or something. Take a seat and join us. Hey, nice.
It's great to see you.
Yeah. Well, thank you so much for joining us. Now that you have your new back, did you run here today? Did you
I
run?
couldn't.
You could. Okay, so I want to take a few minutes here. Tell us about your I guess your story, what happened to initiate the back pain, and then I guess the journey in leading you to Dr. Maxcy?
Wow, that's a lot to fill in.
And you got 3 minutes, go.
1997, I bent over to pick up a video conference unit for the Department of Defense, and I heard my back snap. I passed out, and it was a bad scene. From that day forward, the pain has been relentless. Some days are worse than others. Let a cold front blow through here, pick something up off the floor, you never know what's going to set it off. Early on, I began taking pain pills, and that continued for 20 years. And that too has had a real bad effect on my life. So approximately 2015, I found Dr. Maxcy, and as she indicated in the beginning, she believed me, and she worked with me, and she wasn't going to stop until she found a solution for me.
What do you mean she believed you? I want to hone in on that for a second,
Well,
because I think people out there have faced this where they're not believed.
I think it's a big problem. You can't see a sore back. There's no scars, there's no swelling, there's nothing that indicates it. The only thing you can tell is somebody's mobility.
Mm-hmm.
So frequently I go to it. I had one doctor tell me that with my back I should be doing cartwheels in the parking lot. Oh, that was a doctor, a medical doctor that told me that, and an IME. It was not that. But one way or the other, it was many doctors, the chiropractor was my second mailing address. So it's been a long journey for 20 years.
Okay.
And getting away from the pain pills was probably my biggest priority.
Mm-hmm.
And with this unit, I can do so.
Okay, this unit, what do you mean? Show us, tell us.
These suspenders are not a fashion statement.
I don't know, they look good.
No, this is an antenna.
Okay,
And this antenna talks to the frequency generator.
okay.
And I can program the generator, as Laura indicated, to go to the specific areas where it's painful that day. So I keep this with me, and I wear it daily.
Mm-hmm.
It in turn talks to the implanted devices that the doctors put in.
Okay.
So on the way home from the surgery, I stopped off to buy a donut. And when I got out of my car, there was no pain. And that was the day of the surgery.
And were you like, wow?
I couldn't believe it.
Mm-hmm.
I'd lived with this, it'd become a way of life.
Yeah.
And so it works.
It is, and you sit back and I hear you talk and I'm like, I don't want to say you lost 10, 20 years of your life. I don't want to say that, but you lose a lot, you know?
Well, between the pain and the pain pills,
Yeah.
you've lost 20 years of life. I was 42 years old when I initially injured my back. So that's a pretty accurate statement.
So then you found Dr. Maxcy. She told you about this surgery. Did you believe it?
No.
No. I didn't believe it either.
There was a thin percentage because Dr. Maxcy does not lie.
Yeah.
So there was a thin percentage. that I
Well,
believed.
women in general. They're so true.
Oh, okay. Oh, so there was a thin percentage. I just couldn't believe that there was a device that could remove the pain.
Mm-hmm.
I was so used to it. It had been so pervasive, and nothing touched it.
Mm-hmm.
So we entertained the idea. We talked about it in December of 16,
We talked about it for a while.
and it took that long to finally get it implanted in my back in September of 17. So yeah,
Wow.
I'm 5 months away from it now.
Yay. And you're still doing okay.
Phenomenal. My next stop is to load a pickup truck with food for a pantry.
You weren't able to do that before.
Couldn't touch it. Couldn't put the tailgate down.
Mhm. Now, and I want to be honest because I'm sure there's people out there that say, okay, great, it works, I believe you. Now, what can't you still do? Okay, I mean, you probably can't do cartwheels in a parking lot, but is there anything that, okay, this works really great, but you know what, I'm still not able to lift over 50 pounds, or is there anything that you can't do, or any, I don't want to say negatives, okay, but nothing's perfect. Is there any, what'd you say?
Limitations.
Yeah, any limitations with it?
Well, during the time that my back was injured,
Okay,
it mechanically, the bone alignment and so forth, became different.
okay,
Muscles pull it apart. There's nothing to put it back. And with that in mind, I limit the bending over that I do. But
Okay.
other than that,
okay,
which is a very tiny price to pay,
right.
I'll take it any day.
Well, and it might not even be that you can't bend over. There's got to be a little fear still. You know, after 20 years, my mom has been has had pain, and there are days when she's having great days, and she's scared on her great days because what if I bend over the wrong way, or what if I walk and the walk sets it off, or the cold sets it off. So even the good days, I don't want to say they're bad days, but they're days that you worry. So,
and I think also during the trial period and immediately after the permanent implantation, those leads can move.
okay,
And so that's key. The patient doesn't go outside and do a cartwheel, because then we might have the movement and not be able to capture the pain.
okay.
And that I have not had that happen for a patient that we've implanted permanently, but there have been a couple trial patients, and you name it. I mean, I had a patient 3 days after drive up on his motorcycle, and one of his leads had moved. So
Okay.
I think it's important to really just follow the guidelines and no cartwheels, no bungee jumping.
So you do not recommend when you have back pain cartwheels in a parking lot?
The day after
The
you
day
have
after?
this put in.
No,
Yeah.
okay.
I would wait a good
Well,
like 6,
I don't
8
know
weeks.
about the product.
Well,
I'm
you're
just
making me
saying.
want to go out and
8
try it.
weeks later, go for it.
Yeah. So if your doctor recommends cartwheels in a parking lot when you have back pain, change doctors. Come see her. Okay. All right. Very good. So, how big is your scar?
Very small.
Okay.
2 inches horizontal and probably 3 inches vertically.
Okay.
I chose that we had a number of devices
Mhm.
that perform the same function. And it inherently made sense to me to have the battery and the frequency generator outside of the body.
Okay.
And that's why I chose Stim Wave. I
Okay.
think it's a superior product. And I'm very glad that the doctor chose that for me.
Mhm.
So,
Do you have to do the trial before you get the permanent? So you,
In the United States, you do.
okay. Okay.
Yeah.
So for those of you out of the U.S.
you're
Okay.
lucky.
Okay.
Yes.
Okay.
Yes.
Excellent. Okay, so you do.
The trial's not prohibited.
Huh?
It's not prohibited.
No.
It's a penny's worth of effort for a pound's worth of,
Okay. So you do the trial. You did the trial for so many days,
I think, 4.
4 days, and then you go in for the actual. How long is the procedure on the actual one? An hour?
30 minutes
30 minutes.
at the most. Yeah.
Okay.
Try not to wait 10 months before you
Right.
do it.
Okay, so learn from his mistake. Okay, amazing. Is there anything else that you think the viewers should know about pain, about Stim Wave, about anything in general? Anything that you want to tell them?
Stim Wave has been possibly the most dependable product I've ever seen. It's just reliable, it works, and it does exactly what they said they were going to do. Pain pills, while they look like a good alternative, are not. The residual effects coming off of them, the foolish things that we do while we're on them, it's just a bad deal all the way around. And I really advise people who think that opioids might be a solution to rethink that. I did it for 20 years, and I tell you without reservation, it's a very harmful and hazardous route to go.
Okay.
So, yeah, where there's an alternative, and I found one, I was lucky enough to have a doctor that was able to implement it for me, and my life is entirely different.
Okay, for the better.
Oh, by far. Thank you.
Awesome. Thank you for sharing your story with us. Okay, so we are coming up on time today. I guess I want everyone to know where they can find out information about you. Tell us.
So the website is www.usaspine.org, and then our office number is 813-855-8400.
Okay. Are there any people out there that you wouldn't want to work with? You've
No.
had so many surgeries, or no.
No.
Anyone with pain can give you a call,
Yeah.
and you got their back. Ha! That needs to be your new tagline.
Get jingled.
Dr. Maxcy, yeah, I got your back. I want 10% of all profits
Okay.
on that one, okay? Excellent. Okay, if you could leave the viewers with one piece of advice today, what would that be?
To take charge of your life, and don't let pain prevent you from living your life.
I love it. Excellent. And enjoy your weekend this weekend. Hopefully pain-free. If you are in pain, you know you can call Dr. Maxcy, and it's usaspine.org, right? Excellent. Okay, so next week on the Dr. Jaime Show, we have President of Marketing Matters, Colleen Stearns-Leeds. Do you want more social media followers? That's going to be an episode you do not want to miss. Happy Friday. Hey everybody, thank you so much for watching the Dr. Jaime Show episode this week. I really hope that you enjoyed it. Do me a favor and subscribe to me on iTunes and YouTube. And of course, please give me some feedback on the show. Looking forward to reading it.